Okay, so I will be doing the IV push demonstration. So I will be doing the metoclopramide medication, which says you can give undiluted if less than 10 milligrams. So let's say the doctor's order is 5 milligrams. So you will verify the doctor's order. You will go into the med room. You'll do your first check. So you'll do the 5 rights. So it's the right medication, the right patient, the right time, the right dose, and the right route. So it would be IV push. So you've done your first check, you pulled it from the Pyxis, and you'll be giving it undiluted because it's 5 milligrams, and it says you can give it undiluted if less than 10 milligrams. So you will clean the vial.
Okay. So let's do that. I'm going to put this on.
Okay. You'll be putting 1 milliliter, 1 milliliter of air into the vial.
Blood return, okay.
Before you pull.
Attach. This part of this. Okay. 1, 2, for 15 seconds again.
Okay. Make sure there are no air bubbles. So you'll be checking. Make sure there are no air bubbles. Okay. And then you will recap one-handed. Okay. And then you will label your medication. So you will label 1 milligram or 5 milligrams or 1 milliliter. And you'll put your initials. So you'll have a piece of tape and you'll write it down. And now you're ready for your second check. You will take this with you to the computer because you will need to scan the medication. So you'll do your first check. So it'll be metoclopramide, right patient, 5 milligrams, and the vial is not expired. So that's your second check. So then now you'll do hand hygiene. And you will walk into the patient's room and you will introduce yourself and identify the patient. So identify their name and date of birth and their allergies. And you will do your third check. So you'll scan the med and verify it with the computer. So the medication, the dose, and that the vial is not expired. And now you will explain to the patient the medication that they're getting. So metoclopramide, it is an antiemetic, so it affects the tissues of the upper GI tract. So you will explain to the patient what they're getting it for, and you will put on your gloves. So you will get clean gloves. And pause the IV and make sure it's clamped.
And how you feeling, Mr. Smith? You good? Okay.
Assess the IV site. Assess the IV site for redness, urethra, edema, drainage, and accommodation. Site looks good. So you will first clean the hub, scrub it.
Apply the 6 ml.
So yeah, so I will open it, and once I have it open,
and again,
I
will push for 4 minutes.
And you will prepare
0.75 every 30 seconds.
and then I could just take this time to find my
Push,
so I would have that there.
push.
And you will
Okay.
unclamp, make sure
Done.
the IV is
And I will
primed.
apply a port.
Okay.
And then from here, I would then sign the
Now you
computer
will
that
attach
patient
your medication.
Got the medication.
And it says to give over 2 minutes.
And the tape.
So I will give 1/2 a
I'm
milliliter
sorry, I'm going to
each minute. So I'll give 1/2 a milliliter over 1 minute.
To get a hold of me, please call the rest line as possible.
So for the sake of demonstration, I've given it over 1 minute,
Speaker, inside,
and then I will give the other half over the second minute. Again, for the sake of demonstration, I've done it for 1 minute. Okay, and as you're administering the medication, you're talking to the patient, making sure that they are not having a reaction to the medication.
15 minutes, okay? So, before we get started, we want to
And then
check the responsibilities by
you will
that. If there's something running, we want to pause the pump. We want to
clean the hub,
and depending on how much
prime,
the amount, we could even unattach.
going to do your second dial, and then you're going to do it again over 2 minutes, so you can flush the same amount of normal saline for over 2 minutes. So you're going to go 1/2 milliliter over the first minute,
The assessment.
and then another milliliter over the second minute.
Vital signs.
Okay.
Okay. Let's do it then.
Then you will attach to the IV if there's a fluid running. You're going to clamp, or unclamp, I mean. And you will start the IV. And then, so you will have done vital signs before the administering of the medication, 15 minutes before you give the medication, and then you will do another set of vital signs 15 minutes after the medication is administered. So you will document what medication you've been given, the time, the dose, the route, and you're going to sign your name and how the patient tolerated it. And then you will come back in 15 minutes, assess the patient, and do another set of vital signs. And you will make sure the patient is comfortable before you leave and that the call sign is within reach. And that is it.